Hello, I'm Dr. Samantha. I'm a naturopath that specializes in hormone health and fertility care, and today we're talking about our thyroid. So welcome to part 2 of the thyroid series. I'm so excited to have you here. First, please don't forget to hit the subscribe button if you have not done so yet. I come out with a new video every single Friday. So today is part 2 of our thyroid series. I'm only gonna make 2 parts, maybe if it gets more traction. And if people even wanna dive further into the thyroid, we can totally create part 3 and part 4, but right now I think this is a really good basic. So I said in today's video, we're gonna talk more about optimal versus normal thyroid values, which is what a naturopath definitely specializes in, and then possible treatment options. So to start, let's cover labs that I like to get done for the thyroid. So in the last video, I said TSH, free T3, free T4, and then thyroid antibodies. Some people also really like to get reverse T3. I do feel like that can be really handy, but a lot of times the other values cover a lot, and usually if we can see something wrong there, we might want to then check reverse T3, but ultimately those other values are the ones I like to start with. So for TSH, optimal value is between 0.45 and 2.5. So essentially you want it under 2.5 and over 0.45. Normal value is usually between that lower end, so 0.45 and around 4.5. So you can see that that's a big difference. We definitely want to make sure it's under 2.5. Sometimes I even strive for under 2, depending on like the person in the case. Most of the time under 2.5 is just fine though. For free T3, I usually like it above 3. That's a great value for me. So if I see it even floating around 2.6, I'll definitely want to do things to optimize that thyroid. For free T4, upper range is going to be desired. So between like 1 and 1.6, we really like to see that, just like I said, in the upper range if you are looking at your labs right now. Thyroid antibodies, I used to say anything under 30 for TPO antibodies. Now I'm actually even going more towards under 15. I really want to make sure that those aren't an issue if pregnancy does occur, because a lot of my patients have worked really hard to get pregnant and we just don't want that to cause a loss. Thyroid globulin antibodies, we want under 1. And sometimes again, that can be a pretty big range. So the goal is to make sure we're all within those optimal ranges. That is going to be very beneficial for you in working towards your fertility goals. So ultimately, those are those optimal values. Now, what do you do if things aren't exactly the way you want them? So most of the time during the fertility journey, people are put on medication. Levothyroxine is a big one. There's also ormothyroid, synthroid, and so on. Those are used for hypothyroidism. Hypothyroidism is, like I've said in the previous video, that's going to be an underactive thyroid. Sometimes even with subclinical hypothyroidism, which basically means you can't technically be diagnosed with it because your TSH is either fine or within that normal range. You still might be given medication. So say it's within that normal range, but then your antibodies are elevated. This is a time where sometimes practitioners will now give a medication to help also lower those antibodies, which could be very important. So now what do you do with hyperthyroidism? A very common treatment is ablation therapy. That can be really intense, and I definitely recommend working with an endocrinologist with that. That is something I know me as a naturopath does not do, and you can kind of look into that more. There are also medications for hyperthyroidism, and I can work with the medications and then also the herbal remedies for hyperthyroidism. But like I said, the ablation therapy is just something that I'm not going to do. Ultimately, with a naturopath and healing the thyroid, things can get a little different, right? We look at things beyond just medication. So what else do we do? Obviously, we're gonna focus on diet and lifestyle. I know one of the big ones is remove gluten. Absolutely remove gluten if it bothers you, but if it really doesn't, honestly, I say keep it. Or unless you test positive for like celiacs or like an actual allergy, you obviously want to remove it then, but otherwise I don't like to remove a lot of foods unless we absolutely have to. So that one is one that's really popular. A lot of times they just recommend like testing it out on yourself, seeing if gluten truly does bother you, meaning you can just eliminate it for 2 weeks and then add it back in, wait about 3 to 5 days. That's how many days it can take for for symptoms to show up. See if symptoms show up. If they do, obviously stop eating it. If they don't, maybe just continue to eat it. Still monitor how you feel, but you might not have to cut it out completely. However, if it does bother you, I highly recommend cutting it out completely because that can 100% impact your thyroid and your thyroid function. Obviously, eating whole foods, having movement, getting good sleep, those are all gonna be so important for thyroid function. And I feel like they're so underrated. A lot of people just skip over that and just give people thyroid medication. And that makes me sad because I feel like there's an opportunity missed. If you want details about like diet, lifestyle, sleep, and all of that, I do actually have another video. It's called Preconception Care Do's and Don'ts. And that's gonna be really helpful with a lot of tips about diet and lifestyle. And what you do for that will also be really great for the thyroid. I do also have ebooks that also specify all of that, which will be in the description below. So diet and lifestyle, great, glad we talked about it. What are other things we can do? Honestly, looking at other components of your health. So this means reducing stress, right? Stress is a huge one, and that can definitely make things worse. Sometimes people say, is it the chicken or the egg? Was your thyroid messed up so you're caused to be more stressed, or were you stressed and that caused your thyroid to be messed up? Honestly, I feel like it's a little bit of both. So definitely work on stress. People talk about iodine and selenium. I do think both of those are great. Sometimes I have people test their micronutrients before we start supplementing with iodine or selenium because we want to make sure you don't have too much of them. They're important, but too much can also cause the opposite of the desired effect. So a lot of times I like to double check. Usually though, selenium in your prenatal and then maybe like a Brazil nut is totally fine. Iodine, I think I'm a little bit more picky with, and I do recommend getting it tested. But those are really important in creating thyroid hormone. So they are going to be some of those building blocks, specifically iodine. So it could definitely be worth testing and checking out. Another thing I would look at is your gut health. So gut health just matters so much. I feel like with every single thing, whether it comes to healing your hormones, like your reproductive ones or your thyroid, it makes a big deal. So I'd highly recommend getting your gut checked out because I don't think your thyroid can function properly if we're not absorbing nutrients right, like iodine and selenium, or, you know, just having our immune system function properly. And then if our gut's also messed up, I already talked about the immune system, but it is 70% of our immune system, so it does matter. But then it can also increase inflammation in the system, and we really don't want that, right? So checking on the gut health, checking on anything else that's actually kind of an issue for you, making sure all of that is optimized as well. Now, sometimes the thyroid can be the root cause for a lot of the other issues going on. And so, you know, depending on where your values are at, you can 100% get on medication and then also do the diet and lifestyle things. I highly recommend that. There's also a couple little tips and tricks, little secrets of the trade for naturopaths that I'm not going to say in here and just leave those for my patients because I do think it needs to be monitored just like medication would need to be. And so I'm going to, like I said, kind of hold those close to my chest. But if you want to work together and work on your thyroid function and heal together, I would absolutely love that. If you wanted to book a one-on-one visit or even book a consultation call, you can check out that through the link in below or on the bio of my YouTube or even check out my Instagram. But ultimately, I hope you enjoyed this video. I hope you learned something new today. And if you did, please give it a thumbs up. It means the world to me. Don't forget, we come out with a new video every Friday, and have a beautiful rest of your day.